Healthcare delivery systems are the foundation of how we receive medical care, ranging from everyday wellness to specialized treatments. Understanding the different types of services and settings helps us navigate the options available and ensures we get the right care at the right time. When we talk about healthcare delivery systems, we're really talking about where and how care is provided. We'll start with primary care, which serves as the front line of the healthcare system. Primary care providers are usually the first point of contact for patients and play a key role in maintaining long term health. They offer ongoing comprehensive care, including prevention, diagnosis, and treatment of everyday illnesses. In addition to managing chronic conditions like diabetes and high blood pressure, primary care helps coordinate specialist referrals when needed. A major focus is on health promotion and disease prevention, helping patients stay well rather than just treating illness when it arises. Ambulatory services are for patients who don't need to be hospitalized. These are outpatient services like diagnostic tests, rehab for cardiac or respiratory conditions, or same day surgeries such as knee scopes or colonoscopies. You go in, get treated, and you go home the same day. Because of that, ambulatory services tend to be more cost effective and convenient for patients. Now let's look at long term care. This is designed for people who need support over a longer period of time. And this includes skilled nursing facilities. These provide 24/7 nursing care and rehab services. Think of it as hospital level care for longer term recovery. Intermediate care facilities offer some nursing care, but not around the clock. They're ideal for people who need some help, but not constant attention. Adult foster homes are small, home like settings where about 5 residents receive 24/7 care. It's personal, familiar, and supportive. Then there's assisted living. These offer meals, housing, and help with daily activities. It's for those who need medication help, but not full time nursing care. And last, we have continuing care communities. And these offer a mix of services that change as your needs change. So you can stay in one place as your health situation evolves. More and more people want to age in place, to stay in their own homes as long as possible. Why is this becoming more common? Well, shorter hospital stays mean people need help once they're home. In other words, people are discharged sooner and not quite ready to care for themselves. In addition, there's a growing older population, many of whom prefer familiar surroundings. Technology and equipment like wearable devices make home health care easier and safer. And there's a strong desire for independence. People want to stay in their homes, not move into care facilities. To make this possible, a team of professionals support care at home. This includes home health aides, nurses, physical, speech, and occupational therapists, and social workers. They all work together to ensure the patient gets what they need right where they feel most comfortable. Next, we have hospice. This is also known as palliative care, and it provides support services for patients and families at the end of life. It includes medical, emotional, social, and spiritual care based on the needs and wishes of the patient and their family. The goal is to ensure the final days are comfortable, pain free, and filled with dignity. Palliative or hospice care can take place at home, in a skilled nursing facility, or at a hospice center. It's about support, compassion, and comfort when it matters most. Next, we will review urgent outpatient care. So, first, we have minute clinics, and these are often found in CVS. These are walk in clinics that let you see a nurse practitioner on demand, whether it's a strain, sore throat, or physical, it's quick and accessible. Then we have urgent care, and these are typically open daily from early morning to late evening. And urgent cares handle less emergency or non emergency issues like infections, minor injuries. They offer diagnostics like x rays and lab work and EKGs, often with a higher copay. There's also orthopedic urgent care, and these are for injuries like sprains and falls. And this is your go-to for bone injuries or joint injuries. And they provide focused orthopedic care, quick imaging, and immediate follow-up scheduling, keeping you out of the emergency department. There's also an emerging trend to note: medical malls. So some communities now offer all in one outpatient services at a discounted rate. And this includes adult daycare, making healthcare more affordable and accessible. So let's talk about public health services, which promote wellness and prevent disease through immunizations, screenings, education, and managing mental health and chronic conditions. State and local health departments lead these efforts, monitoring communicable diseases and working with federal agencies to protect public health. Some examples include the Office of the Aging, a lifeline for seniors offering help with transportation, meals, medications, and navigating care options. There's also state and local health departments. These provide education, immunizations, mental health resources, substance abuse support, and screenings for chronic diseases like diabetes and cancers. The state health services is where the state also delivers lab testing, emergency medical services, and tracks both chronic and infectious diseases to keep communities healthy. So let's take a moment to explore a growing area in healthcare, which is complementary and alternative medicine, or CAM. CAM includes a wide range of practices and therapies that fall outside of traditional Western medicine. These approaches focus on the whole person, mind, body, and spirit, and are often used alongside or in place of conventional treatments. From acupuncture and massage therapy to naturopathy to herbal medicine, CAM is becoming increasingly integrated into modern care. In the next few slides, we'll take a closer look at some of the most common CAM practices, how they work, and where they fit into today's healthcare delivery system. So, holistic health expands traditional healthcare by focusing on the whole person: mind, body, and spirit. It looks at physical, emotional, spiritual, and environmental factors, not just symptoms. The goal? It's to prevent diseases before they start, rather than just treating them after the diagnosis. Now let's look at homeopathy. This is a form of complementary medicine that's been practiced for over 200 years. Homeopathy is based on the idea that like cures like, meaning that a substance that causes symptoms in a healthy person can be used in extremely small amounts to help treat similar symptoms in someone who's unwell. These remedies are usually made from natural sources, often plant based, and are highly diluted to stimulate the body's natural healing process. What sets homeopathy apart is its focus on the whole person, not just the physical symptoms, but also emotional and mental well being. It's most commonly used for chronic conditions, and the goal is to support long term health in a gentle, individualized way. When it comes to hands on approaches in healthcare, two distinct paths often come up, and that's osteopathy and chiropractic care. While they share some similarities, they serve different roles in patient care. Osteopathy, practiced by doctors of osteopathic medicine, or DOs, take a whole body approach to health. DOs are fully licensed physicians who combine traditional medical practices like prescribing medications or performing surgery with hands on techniques known as osteopathic manipulative treatment. The goal is to support the body's natural ability to heal itself with a focus on the connection between structure and function. On the other hand, chiropractic care is centered on the spine and nervous system. Chiropractors specialized in manual adjustments to correct misalignments, relieve pain, and improve mobility. While they are not medical doctors, chiropractors are trained and licensed to treat musculoskeletal conditions, particularly those affecting the back and neck. Both disciplines emphasize the power of touch and movement in healing, but osteopathy integrates this into a full spectrum medical care, whereas chiropractic focuses specifically on spinal health and alignment. Wellness is all about prevention and building healthy habits. It includes plant based nutrition education, natural methods to reduce blood pressure or blood sugar, and integrative medicine, which blends traditional treatments like medicine with practices like meditation. It's proactive approach to staying healthy before illness strikes. Some other therapies that work alongside traditional medicine to support healing include massage therapy. This uses pressure to relax muscles and boost circulation. You have naturopathy, which supports the body's natural healing through diet, exercise, and natural remedies, and acupuncture. This is a traditional Chinese practice using fine needles to relieve pain, improve wellness, and manage stress. In today's evolving healthcare landscape, knowing your options empowers you to make informed decisions for yourself and your loved ones, whether it's preventative care, long term support, or specialized treatment. The healthcare delivery system is designed to meet your unique needs and promote a healthier life.